Healthy choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back, everyone. October is Breast Cancer Awareness Month, and it is time to make those mammogram appointments. Intermountain Health's Breast Care Center at Intermountain Medical Center in Murray is helping us out with that. In the sponsored interview, we have Dr. Eugene Kim along with breast cancer survivor Linda Campbell. Thank you both for being here.
Of course.
Thanks for having us.
I want to start with Linda's story first of all. How was your cancer detected?
So I get my routine mammograms every year, and the end of 2022, my sister was diagnosed with breast cancer. So had my mammogram, and we've been doing a risk assessment as part of those mammograms, and that did put my risk a little bit higher with my sister having been recently diagnosed. And so it recommended the fast breast MRI. So we did the fast breast MRI on me and recommended an ultrasound. There was a finding on the MRI, had the ultrasound and biopsy, which came back as invasive ductal carcinoma with some DCIS. So had surgery, radiation treatment, and I'm now cancer-free on some oral medication for a few years, but yeah.
I'm so glad, and early detection is everything. And a quick little twist and a note on this, you work with the Breast Cancer Center.
Yes.
At Intermountain, and you didn't delay, but you were high risk, and you even told Dr. Kim what?
I said, the guideline is 20% increased risk, and mine was 21.4%. And so I'm like, do I really need to do that? It's like barely over, right? And he's like, nope, you need to do it. You're the perfect candidate. And I'm like, okay, I'll do it. And so,
Linda, how thankful did you are you of Dr. Kim saying, no, you got to do it?
So thankful, because I kind of talked myself out of that. I mean, I see it every day, but I never thought it would be me, right? So I'm so thankful that he told me that it still is very important, even though my risk factor was barely elevated, it was still elevated, and I was a perfect candidate for this procedure.
Okay, Dr. Kim, so many excuses not to get your screenings. We have some of the lowest rates here in Utah, and moms are busy. We are the last to really take our care and our health into our own hands, and this is the reason why Intermountain has increased their hours and in fact included Saturday appointments.
Yep. Yes, Sherry, like you said, with breast cancer, it's all about early detection, and Linda's case is an incredible example of that. At Intermountain for this month, we are opening Saturdays for screening mammograms to help alleviate some of those scheduling issues that women can have.
Working moms, they can hardly get into an appointment, and Saturday might be the best time. Why do this?
So like we said, early detection is key for breast cancer, and getting your screening mammogram once a year is really the best way to detect breast cancer early. Now, if you are at higher risk for breast cancer like Linda, there is an additional exam that we have started at Intermountain called the fast breast MRI. In that case, and in Linda's case, that was really pivotal. So if you are at higher risk, that fast breast MRI can be really important. And this is a program that we started last year, but it has expanded to more hospitals throughout Intermountain, throughout the state. So the access to that should be better this year as well.
And what's important to note, this doesn't take the place of regular screening, but if you are at high risk, who is this fast MRI for?
So like Linda mentioned, we do this risk assessment model here at Intermountain that kind of takes into a lot of different factors, including age, family history, breast density. And if you're at that 20% or higher risk for developing breast cancer in your lifetime, that's who should get this fast breast MRI.
And what happens once that there's a positive detection then with the fast MRI? Then you have more screenings?
What they recommended for me was it's like called second look ultrasound. So they scheduled an ultrasound with a potential biopsy if they determined that that was necessary. So at that ultrasound appointment, they determined it was necessary to do a biopsy. Dr. Kim did my biopsy. And then those results go to pathology. So you just kind of have to wait a few days for those to come back. But it's usually additional screening and a biopsy.
Linda, what would you tell people out there, some moms or grandmas who are kind of skeptical or they're putting it off?
Yeah, don't do it. I am so thankful and so lucky that we caught mine so early. It was very low grade. I have an excellent prognosis. I was able to avoid chemo because of the type of my cancer, but also because we caught it so early. So don't hesitate. The screening and that early detection is so important.
Linda, a living example of why you should just go. Listen to your gut and say, just make that appointment. It's not very long. Dr. Eugene, there's still time to make that October appointment on Saturday, right?
Absolutely.
To schedule a screening, visit intermountainhealthcare.org or call that number there on your screen. Thank you all so much. I think it's a testament of what can happen if you delay or not delay.
Thank you.
Thank you.
And thank you to Intermountain Health for this sponsored segment. Dina, now over to you.